before we end, we must have sealed all of them to send to Bata. Okay, ladies and gentlemen, as some of our members complete the consent forms, we are going into an interesting activity. And before we start the activity, you need to give me. Okay. We want to get numbers. We are going to have 4 workstations, and they are going to be randomly created by dimension of 1, 2, 3, 4.
5, 6.
1, 2, 3, 4.
5, 6.
1, 2, 3, 4. And you automatically fall in the workstation. I think I'm neutral. So I'll start here. 1, 2,
3,
4. Wait a bit.
16.
They want to hear what you're mentioning. 4. Wait a bit. 1, 2, 3, 4.
3, 4.
I can't confuse us. Ruta is 3. Next. Yes. 1, 2, 3, 4.
16.
2, 3, and then 4. Repeat. Emmanuel, you want? Emmanuel is excluded. You want 4. You want 4. Okay. The young man is going to co-facilitate with me. Yes. The young man is going to co-facilitate. Okay? So ideally, I want to hope that we have the consent form, and you're not here because you were forced to come, but you are here at your free will. That's the essence. I know some of you are forced by your supervisors. Some of you feared Dr. Maggie not seeing you here. But by signing, we are sure you are here at your free will. Then, the survey. The survey is very important because it's going to form part of inform the advocacy for frontline health workers. Yes. So Emmanuel, whoever is still completing, you'll pick from them. Then, yes, we now have all our groups. We know where we belong. And what we are going for is a workshop that we are calling Face of Care. And from the virtual sessions, you were hearing the discussion. The whole background to this started in the 2022 Pata Summit, where we had discussions, and we were looking at what makes you as a frontline health worker to feel empowered and motivated to be able to serve children and adolescents at your workstation. I hope we'll all remember that discussion. It was very engaging, and we did a lot of work. We had sticky notes, you had lots of responses, and then we went into a fishbowl discussion, and we had the panelists, and it was really engaging. And that feedback is what is informing today's workshop. we want to continue engaging on those issues and get deeper into them. So in today's workshop, we have 4 workstations, and the first workstation, we are looking at the work environment. Now when you look at the back, where we have those long tables, those are the workstations. And if you look at station 1, I think it's right in the corner. It's talking about the work environment. And last year, you told us that you wanted more teamwork, you wanted their supportive supervision, and the mentorship, stronger relationship with the colleagues, such issues. So we want to have more discussion around that. Then workstation 2, we are looking at mental health and well-being. In the discussions, we were seeing that point where like people are thinking with a lot on their mind, and that is 2. Do you see 2 there? Workstation 2. Where is it? It's that one. Yes. So last year you told us that the social and health workers need more support in their work environment, but also outside their work environment, outside health facilities. Maybe beyond the health facility, when you go back home and wherever, you need a lot of that social support. And when we will be then the third workstation is looking at peer support and integration. And you were saying that the peers are not very well integrated into health facility teams. So we are going to dive deeper into that to see maybe by the time we leave the Bata Summit, we will have solutions on how better that can be done. Then last but not least, we are going to look at children, adolescents, and young people. And that is workstation 4. Where is it? Just in the corner, near Vivian. And you were saying you wish to have more meaningful engagement with the empowered young people and their caregivers. And the focus is going to be around that. So we are looking at children, adolescents, and young people, and we're saying you told us that you want to have more meaningful engagement with empowered young people and their caregivers. Yeah. So we have 3 objectives to meet in today's workshop. And the number 1 objective is to continue this conversation about how best to support and empower you. By you, we are meaning the frontline health workers. So we want to continue the conversation on how best to support and empower you in the face of care, generally, the face of care. And then 2, we want to give an opportunity to engage over the key findings of the 2022 Bata Summit in regards to the face of care. Am I clear? To provide that opportunity to engage over key findings, those issues that came out. And part of them is what is forming the workstations. And then 3, to provide you with an opportunity to connect with others in your area and try to find locally appropriate and empowering solutions to the challenges raised in the 2022 Bata Summit. So, of course, you are here with many people from all over, from different workstations, and you're relating there, your fellows. When we say others, you are a peer support and there are many other peer supporters. You're a health worker and there are many other health workers. We are from the NGO fraternity, and we have many other members from the different groups of the implementing partners. So that is what we want to focus on. We have, okay, I said the three, but there are also these other objectives to allow hear the perspective and the ideas of others working in the same field, but in different environments and occupations. At some point, we are all supporting children, we are all supporting adolescents, and we just want to hear that experience. Yes. But also to allow us better understand what is needed for an ideal, empowering work environment for you, the frontline worker, and facilitate development of local solutions. Like solutions should come from within us. Then the very last one, to empower you to reflect on what positive actions you can begin to take, which will bring about change despite resource limitations. Resources are never enough, but within our means, we can always have solutions. So, do we have our 4 groups? So when you go to your workstation, we'll be looking at these materials. One, you must have an image in front of you, and then a chart paper with the theme. We should have written this, the chart paper, but we decided to print even the chart paper. So below the image, you can be able to read what it takes. And then you need to have a marker. We need a note taker within your group. Now the note taker will pick a flip chart and that marker to summarize your responses as you'll be discussing. So what is going to happen? At every worker, you're going to look at the image before you. The chart paper has already described what you're looking at. And then you're going to answer 5 questions. These 5 questions are same across, but they answer specifically to what is in that workstation, to the theme in that workstation. For instance, the first question will be asking, does the image or theme reflect how things are where you work? So if you are at the work environment at station 1, answer in line to what you're seeing. If you are at a point of mental health and well-being, answer in line with that. If you're looking at the peer supporter, answer in line to that. Second question, for your theme, what possibilities do you see for change to create a more empowering and supportive environment within your facility? Again, we'll be answering that question. That means within your group, you are summarizing. Somebody is taking notes as you agree. Whatever point you agree upon, we quickly summarize. And then 3, what can you and the others at your health facility do to create a more empowering and supportive environment? Now these are the local solutions we are looking at. Before you call Dr. Maggie, hey, we need what is within your means. Which solution can we have in that line? So we are going to get local solutions at that point, those within our means. And then 4, what, if any support, after your local solutions, in case of any support? What, if any support is needed from outside your facility to create this change for your theme? So it's like asking, I don't know if I'm reading it well, that in case you need any other support, what is it that you would need from outside? That is the question. After your local solutions, in case you need any other support from outside, what is it? Then 5, are there things that you can do or are already doing in your facility that others can learn from to create a more supportive and empowering environment for you? Now, that is going to be the interaction in every workstation. Maybe every workstation will have a maximum of 6, from what I observed from the participants that we have. It may be a maximum of 6, but most of them may have even 5. And then, after you've summarized your responses, that may we are allocated 60 minutes for that session, and after that we are to go for tea. But remember, we ate into our time. Can't we reduce? We can reduce. So if you save me 25 minutes from the 60, that will be very good. If you save 25, then you're using 35. No, then 40 at most. 40 at most. 40 at most, because there are 5 questions. So if 40 on each question, you may take about 4 minutes. Is that okay? So when we are done, we'll have a quick healthy break, and then we'll return in a different setup, and we'll go for a fishbowl activity, where from each group, you will select a representative to come and share what you discussed. So when the 4 groups with each representative share, we shall also have an opportunity from the 4 categories: health workers, nurses, peer supporters. I'll read at that time, but you know the groups that are in here, from the development partners, to come and make an addition to what the representatives in the different groups will have shared. But also, in case you feel your representative has not said everything you agreed upon and you want to make an addition, like we did last time, those who attended, you simply come, walk slowly, and tap on the shoulder of your representative, and that person will be able to move back and give you the seat. Now that session will be recorded. We shall record, and at the end of the session, we will compile everything together with what the note taker will have compiled, and we shall share all of them with the partner team in South Africa, together with our consent forms and the survey. So that is how our next session is going to run. When we keep time, but also have an engaging discussion, we'll live on time, but with the meaningful outcome. So I want to thank you for listening and taking heed to those instructions. And I want to ask you right now, if you are number 1, you look for station number 1. If you are number 2, you look for station number 2. If you are number 3, station number 3. If you are number 4, station 4. We don't have 5. We don't have station 0. That one is called facilitating with the
Number 3 is there.
I need food there.
Three, go up.
We got an instruction, members, no sticking on the walls. You look for wood, you can stick on the wooden parts or glass, not on the walls. On your presentations, you have to indicate Kampala satellite on top. Kampala satellite. I think even on those images we needed to put something. Kampala satellite. Yes, we shall have an opportunity for members to rotate and see what is happening in the next workstation. You'll move around, especially after you put your ideas together. You just check and see what is happening in the next workstation. And if you feel they've left out an idea, you can even propose something to that workstation.
Yeah, just to add on to what Ezekiel has said, per station, for now, let's take a maximum of 10 minutes. The good thing is that we are few. After those 10 minutes, you move to the next station, you discuss it, you document, and then you move on to the next. So you have to participate on all the stations. Yeah.
So, any challenges? You raise your hand. Any challenges? You raise your hand.
We are four.
We are four. So, we are aiming for many relationships with children, some more meaningful engagement with children, adolescents, and young people. Supporting parents to be happy and healthy as motivating
that the image stop being projected how things are when you work. It is taken at
included feeling
does it reflect how things are done
and seeing the
in the wound you tell you that kind of relationship encourage share and that regardless. Then here it's like the facilitator in charge and that's the image. What's the thing? Good what you
Yes.
then I'll see this. In this research, Frontline will come and express that they want work environment. And then they share that they do not feel appreciated with their work. And they wish for more acknowledgement and appreciation from colleagues and clients. They also say that supervision and leadership and that they would allow performance assessment they are to support their professional growth and safe space as patients and troubleshoot supervisors and mentors. They also request spaces debrief, discuss the emotional impacts of work-related challenges and seek support when they are feeling overwhelmed or struggling with careers, trauma. Unfortunately, participants describe limited opportunities for supportive supervision and leadership within the context of strained human resources, training, and high client loads. Participants also describe pushing hard to feel
When they're not in the same room, you find this is the door for activations and other doors. Different rooms, but the safety some
We have daily
because I wanted to get, because I sit in it's very, yes, I extend it, but I can still, yeah, now yeah, I can get it. Yes. Yes, got it.
for your faith, more empowered. It's more empowered. So that is your faith. But I would just say despite
Despite that, what do we need?
apart from work, do you want to discuss work in next So we ask for your opinion, what possibilities do you see for So you see that people last year, stress, wish for more appreciation from colleagues and clients, and they also say so those are the things that I was saying. So now they're saying, if like it's or maybe it is not happening. So they're saying for your field, what possibilities do you see for change to create a more, yes, you could be having some sort of change, but more. Yes, I think that is find that when the salary comes even before we get the money to fit so that's also financial literacy. Yeah, financial literacy as well.
What can you and facilitate?
and others at your facility which position
By profession.
what can you and
But this this peer support and this another peer support. For counseling.
What can you and others help facilitate create a more empowering
Transport. Transport is when
I think that is quite motivation or remuneration.
oh, the right one.
It is also another point.
Yeah, so another point.
Number 3. What can you?
How many points? 5.
155.
Yeah, we shall add, leave some space. Leave some space.
Yeah, it's there.
What is needed from outside, Wawelu, your facility to create this change for your theme.
What? If any
Support is needed from outside your facility.
financial support to attract AYPs, you have things like water issues, so you need to get money to buy anything.
So, my first answer is support.
Enough money, there is money to obtain items, outreach,
Are you peer support? What is your peer support? Now this is now it says for now peer support. Answer number 1. I will be community outreach. This I'm now empowered.
I think we also need call them what? Workshops to empower health workers, improving
can come it.
One support from outside. For that to happen.
For two to happen. For number to do
That is a good working environment. Picture you have a good working environment. Is that what you want? But what support do you need from outside your facility to make that work?
Oh, mine.
now.
So, Bagami, if this is not what is happening here, but from outside,
What do you need?
what do you need for this to happen?
To support the support.
What is the
organizing for this outing. We can support you.
So come on, we do what you want, and then we see. The 10 minutes are not 5 more.
Health education.
So 7 more minutes, then you rotate, yeah? Then you rotate to another knowledge.
Where you want to go? Setting up friendly corners.
Describe
Stroke groups.
What other support also in your facility that can be changed? What support is needed? What support is needed from outside your facility for us to change that? You're changing the mindset of empathy.
Then involving chairman, stakeholders, accounts, from outside. This is social media. Social media influence or influencers. You better alternate. But one.
Light, eh? Now my mouth is my cheek is
But you're not putting your
oh, it's taken away. Okay. What have I done? So.
We are not straight in the
Not straight. Take a
certain bend.
Adiwa good, adikutera. Next one you bagenda kudda wana adikutera.
Cosa poche.
So please,
Right in the what is what's fun? Superstar.
Which African session did you
No, you think I'm doing that?
How did you go?
Members, we need to move. Are we done?
Yes.
Everybody is done. Can we see your hands up? This group has completely migrated. Rural-urban migration.
Atewa.
We can pick this one.
This one.
If you have nothing to add, just learn what they've written.
We are taking
In front.
You receive.
Excuse me.
Boss. 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 Why don't we put them on the window? No, on the wood.
Yeah, no,
Wooden
no.
even on the window, just put the masking tape behind the window. Put it on the window.
Don't put on the frame.
But this is what I got.
Yeah, when you talk like that, you look very nice. You know, you concentrate in one small.
Just the materials. Before we start, the materials that we are expected to have, we must have chairs set in front. I hope we are there. Audio recorders. Somebody forgot our audio recorder, but we volunteered. At least 3 phones. Isaac's, Ezekiel's, and Edwin must be doing the recording. So we are going to put them right on the table to do the recording. Chart paper and stand. All we attach on the walls, we've been restricted to pin up. But at least group 1 is representing. Okay.
No.
Do we have a note taker? So you're going to discuss points that stood out. From your sessions. Now just a reminder, and this may be our instructions. When you're given the microphone, you tell us your name, where you work, what you do, and the group you're speaking for, the group you're representing. Just to remind us, we are going to record this. It will be recorded, visual and audio. And also, the minutes will be taken. Now, each group will have 5 minutes to give feedback on the earlier discussion of the theme. 5 minutes, each group, that means each person. And then afterwards, we shall need a volunteer from each professional groups. Do we have nurses here?
Yes.
Do we have a doctor?
Yes.
Do we have counselors? Counselors, you can fall under implementing partners. If we have a community health worker, you can go under the counselors. Then the other group is one of peer supporters. How many peer supporters do we have? Ruta, and then Asasha.
Miriam, this too.
Okay, from this side. So if they, yes, they, so those volunteers can come and add to the ideas that have been shared, or the insights. So you're not going to present what you came up with, but to share feedback and experience how it went live in your group. And then, so this other section where we have members coming to make input, additions, will take 15. Then constituencies, you tell us your name, where you work, and that constituency. Maybe I'm a peer supporter, something like that. And then, after those members have made input, if from the groups you feel that some issues have been left from what you discussed and you need to make an addition, you just walk to the person representing you in that group, tap the shoulder, and you'll assume the seat. And you make an addition to the discussion. And the facilitator, the note taker, the recorders are all going to be focused on these people on the panel. Then, yeah, I think we'll be done. We'll be done. Again, may I say work environment? Work environment? Yes. Frontline provider, mental health and well-being. Yes. Peer supporter integration. Okay, great. Then more meaningful engagement with children, adolescents, and young people. Okay. Okay. So, when you come in your 5 minutes, we expect you for this theme to talk about what the possibilities you see for change to create a more empowering and supportive environment in your areas. Are there things that you and the others at your facility can do to create more empowering and supportive environments? Did you talk about such things? Then priorities and challenges that require support outside your facility to create change?
Yes.
Did you? Group 1 didn't hear anything like that. Which question was that? It was number what? It was 3, so it was there. Are there things that you are already doing in your facility, maybe in the context of our country, that others can learn from? Those are the kind of issues that we want to hear. And then, yeah, we'll be good to go. Are we clear on the instructions? Do we know how we can contribute? You'll walk there and make your input. Are our recorders ready? We want Isaac as a recorder here. Edwin, is yours ready? Those were just instructions.
Yes, please.
Okay, ladies and gentlemen, I take this opportunity to welcome you to this session, and it's the fishbowl feedback to the entire group. At this moment, we are going to hear what you were discussing in the small groups, and like I've already mentioned in the instructions, you're going to give us feedback in line with the 5 questions that you were discussing. And if members of the group feel that there are issues that have been left out, you'll simply walk to the front and then tap on the shoulder of the member from your group, and that member will be able to give you the seat and you'll add to the discussion. But also, when all the groups are done, we shall have members from the categories of the nurses, the doctors, the peer supporters, and then the counselors come and make an addition to the discussion. So I want to welcome the panelists. Thank you for being brave and stepping forward to represent your constituencies. And without wasting time, I want to pass the microphone to the first discussant to share with us feedback from your constituency. Thank you.
Good afternoon, Team Pata. Good afternoon, Team Pata. Good evening. I'm Nangendo Presi from Mobene District, registered midwife, Kalunga Health Center 3. Our theme was good working environment, good work environment. Yes, the theme reflected how things are going on in our facility. Because for us at our facility, we usually have daily tea, what they are showing. If you look at the diagram above, people are there all who are working at the facility and they are taking it together, discussing maybe good ideas. The number 2. Number 2, for your theme, what possibilities do you see for change to create a more empowering and supportive environment within your facility? More possibilities that we saw that we could help to create?
Yes, without reading on the chat, proceed. Just tell us from that image and from the reality and from the discussion that you had, do you see possibilities for change to create a more empowering and supportive environment?
Organizing staff meetings, because the staff meetings help to discuss various ideas that help always bring you together. For example, at our facilities, we organize trips, we go for tours together, so people will be in good working conditions always. Yes, we do.
Okay. Are those the other things your facility can do to create more empowering and supportive environment?
Making a circle. These circles help you bring you together and help in financial management.
Okay.
And then airing out idea, problems among yourselves. Because when someone has a problem, usually in that tea time or what, you come together, you sit, you talk about it. Someone will not stay with stress always.
Okay. Did you discuss any challenges that require support outside your facility to create change?
Yes. The challenge is that you really have that need support, like those activities that you usually do, they need some support. Another one.
Which kind of support do you really need?
We need maybe psychologists to come at the facility and help you, guide you, and enhance your mental status. Because very many people are stressed in your working environment, and that thing can be sometimes solved by psychologists and mental health workers. Then we need support supervision from the IPs. whenever they come and give you more knowledge, you will know how to handle your patients, you will know how to stay around with people. The environment you're working in will be improved.
Is there anything you discussed with your members that you're doing that we can all learn from in regard to improving the work environment? Do you have best practices that you want to share with us?
And the best practices, usually after work, you come, you sit together, you have some plays. People are playing Ludo, others are playing chess. Some facilities don't do those things. After work, everyone will just go. Those things are
Which facility is doing that?
my facility.
Which facility?
Adolescent and Mubende district. Yes, we are organizing the tours. Just last week, but one we've been in Kasese the whole weekend. We go in Kasese as a facility. We enjoy. Yes, we do. I have my colleague he came with.
Members from the Good Work Environment Workstation, is that representative enough of the issues you discussed? Does the member want to add to the discussion? Okay, let's move to the next workstation. You tell us your name, the constituency you're representing, what you do, and then you go ahead and share with us the experience that came out of your discussion.
Thank you so much. My name is Fiona Barrow, and I'm representing theme 2, that was mental health and self-care. I am representing as a peer supporter from Alive Medical Services, Namuwongo, Kampala. Yes, our picture reflected, what was in the picture reflected exactly what goes on. And on question number 2, we were looking at how can we, do you mind repeating?
Do you see possibilities to create possibilities for change to create more empowering and supportive environment?
Yes, and according to our discussions, we looked at how we can achieve that was by encouraging teamwork at our workplaces. Then we also looked at organized infrastructures for designated services. For example, we would have, if it is immunization day, if it is a day for receiving art, so we make sure that there are designated corners for these services so that not all people go to one health worker and then they are crowding in one place. That is what stood out for us. Then another thing that stood out was having an effective work schedule, because we saw that there are days when most workers are absent. So an effective work schedule would be important in that if a worker is absent, it is only one, and there wouldn't be so many that the service provision is affected. Yeah.
Okay, great. Thank you very much. Okay, Bero, in your workstation again, are there things that you and others at your various health facilities can do to create a more empowering and supportive environment in terms of mental health and well-being?
Yeah, what stood out while we were discussing that, we looked at having departmental or team meetings. For example, after a long day of work, or even in the different breaks, we would sit as peer supporters, as clinicians, just to reflect on how the day has been, maybe what can be done better, not as a formal meeting, but just an informal way of approaching some of the challenges that could have gone on during the week or during the day. Then another was to see that at least we share these responsibilities, because you can find that some maybe your fellow could have been sick, but you're just forcing them to do work and you're not understanding their state of health at that moment. So we saw that it is very needful to share responsibilities at the workstations, and also seeing that we manage time, because from the point you wake up, if you fail to manage them, you're going to have backlog. So everything is going to become a burden to you that will affect, of course, your mental health. So managing time is one of the key things to do.
Okay. Did you talk about any issues that come from outside the work environment that also cause mental health issues?
What we discussed was what we would need if it is there to help improve on our mental health, and that is human resource empowerment, because you find that at our health centers there could be understaffing, and a lot of workload can lead to a lot of work stress. So if there is human resource empowerment, that can help to relieve the work stress and the workload at the workplaces. Then lastly, we had talked about the last question, the things that we can do or have already done, is it?
Yes.
And division of responsibilities is very key to ensure that our mental health is okay physically and mentally. And then another thing that we are looking at is to see that at our health centers we have capacity building, whereby we can have just a reflection as workers, a reflection of how it has been in the past months,
peer support attachment. The peer support attachment, like I may reach a time of breakdown mentally, and I cannot disclose it to someone else apart from my peer who will understand the kind of situation I'm really going through. So that's what we looked at, the more involvement of the peer support attachment. That's how we call it. Then the motivation. You find that we do most of the work and we are not motivated, we are not recognized, we are not praised, so we tend to break down. In the next question.
Are there things that you consider that you can do to create an empowering and supportive environment? Generally, things within your means.
Things within our means.
Yes.
Yes. Things within our means, like friendly corners. Like at my facility, there is a youth friendly corner. So there is easy access of knowledge and information. Then the engagement of different activities, we are engaged in different activities like condom distribution, HIV testing, then also the outreaches, we are involved in the outreaches. Also, group of things we are involved in.
So are you saying the rest of the facilities here should follow a lead and begin involving the peer supporters in the outreaches and in the many other things? Because the problem here, we are looking at integration. The peer supporters are not integrated. So what are those proposals that you make or that you discuss in your group that can enable us see this integration come to pass at the facilities and the peer maybe comfortable because they feel involved?
Yeah, the peer should be engaged in different activities. Because if you are engaged, like in the following activities, engaged in the condom distribution, it's easy for you. The HIV testing, you could not be the actual person doing the testing, but you're involved in the activity. So you feel that and shall have that. Also, if you are also engaged in the outreaches, because most times you'll find that we are left out in terms of the outreaches. And also setting up maybe involving us in their staff meetings, the CMPs, in cases of knowledge gaps, because there is a lot that is discussed in their meetings. That could be lacking.
Okay, great. Talk of priorities and challenges that require support outside your facility. You have these priorities issues that you think, on this one we have tried at the facility, but we need extra external support. Are there those specific things that you'd like to talk to us about? For instance, if Pata was there and is ready to do something for us, what is that you would ask Pata to do for you and any other items in the house?
Maybe that one particular thing as a group that we discussed, we looked at the social media, the way we are branded in the media press. So if stakeholders could put up that kind of information and find a way of bringing it and making sure there is the information in the post, that would put better.
You need to be specific on that very one. How are you branded currently and how would you wish to be branded? But I would like to hear that very well. I hope I'm right. What's the kind of brand? What does it look like and what does you like about it? And what is the desire?
Yeah. For instance, I'll give you an example. If I go in the community and I am providing particular services, let's say HIV services, that I'm providing in the community, if I'm going to brand me as someone who is
HIV positive, okay, yes, I could be HIV positive, but the image in the community is not going to be so appealing to everyone. And also, the way people perceive HIV is a bit alarming. Someone else could bring up a better version.
Yes, group members. Ruta, your name? Okay. Okay, another member from the peer supporters is leading the discussion. Yes, tell us your name and what you do, and then go ahead and contribute to the discussion.
Good evening, ladies and gentlemen. Presenting our Edwin Moses is my name. I'm a peer supporter. And the way the media branches, the way it branches us is that in our local language in Uganda, there's a difference between HIV and AIDS. Or we normally say in Uganda, STD. These are two different things. So, in case we are making outreaches, maybe in communities, we are doing HTS, we're giving out HTS kits, maybe we're giving out health education talks. In the media, we are reporting, normally 7, 9 or 10, they will say, they came and did ABCD. In English, and did ABCD. So the media, if we were to get influencers to change the mindset, you know, we have so many youth in our country who are so into social media, like so TikTok, Instagram, Facebook, X. The X is for the former Twitter. So if we would get social media influencers and they would, you know, educate and change the way our people look at HIV, and then, you know, one step at a time, because I'm a peer supporter, I've touched so many people with my time that I've been as a peer supporter. I've been a peer supporter for something of 7 years to 8. So yeah, the media needs to change a little bit.
So that is the media getting involved and changing a little bit, like you're saying it. Who else needs to get involved in this campaign?
This campaign, I'm looking at the people with power, the government officials, starting all the way from our small local leaders, going all the way up. They need to get involved in this. In case maybe funding outreach, we can invite them to come through. They give talks. Now people believe in who they elect. So if they come down and talk to their people and advise them on what to do and not what to do, yeah, people will listen. So I think the government should also be involved. And not only even the government, but even other leaders. A teacher is a leader. So teachers should also be involved, because schools, you know, we have primary, secondary, we have the police should also be involved in this, educating, letting them know the steps to take and how to go about it. Do I answer your question, sir? Is there any other questions, sir?
Thank you. Thank you very much, Ruta. But you remain in the seat unless another person comes and has something to add. I think With that wonderful contribution, let's move on to the next theme. Group 4, more meaningful engagement with children, adolescents, and young people. Yes, next discussant, you're welcome. Tell us your name, the constituency you're representing, what you do, and then go ahead and contribute to the discussion.
Yes, good evening, Pata. My name is Chisache Mary Grace. I'm a peer supporter at Alive Medical Services. I'm representing theme 4, group 4, and the theme was more meaningful relationships with health worker and adolescents, stroke young people. Question number 1 was the image reflecting? Yes, it was. According to my facility, where I come from.
And what you agreed in the group.
Yes, and what we agreed in the group, it was reflecting. Then number 2.
Yes, so for this theme, what possibilities do you see for change to create a more empowering and supportive environment in your areas? The environment where we see meaningful engagement with children, with adolescents, and young people is what we are talking about. Do you see possibilities for change for us to achieve meaningful engagement with children, with adolescents, and with young people? Go ahead.
Yes. First and foremost, like, we need to create a space, a safe space for young people and adolescents, whereby at facilities we need to create, let me say, a youth-friendly corner, or we can call it a chill corner, whereby youths chill corner. Like, young people and adolescents come and they get services, like they be themselves, like they enjoy their space without being interacted with some young people, the adults from OPD, from other centers, from other departments, and also encouraging health workers to improve on their attitude towards us, towards young people, because some maybe it is lack of, maybe they need some capacity building on how to handle young people. Yes, some you may find them when they have family issues, and then for you, like you're wanting like to speak to him or her, like he's tired, he's like, now you're telling me what, you young people. So we also need that capacity building for health workers, and we need like empowering. We also need more health workers at a facility, whereby we don't want to wait like for long hours. We want to come, let me say, today is my appointment, I have come at 10 a.m. I expect like at 1 to be going back home, but you be there, you wait a lot, because they know that you're a young person, you don't have much to do, so you can wait. I think that is it.
Okay, so you're talking about attitude. If the attitude of the health workers change, then there is meaningful engagement with the children.
Yes.
I don't know, you didn't mention the attitude of caregivers, even the young people themselves. Well, somebody else might talk about that. Okay, I think we can move on. Are there things that you and the others at your facility can do to create a more empowering and supportive environment?
Yes. One was capacity building for health workers and also young people.
Like who exactly does this, because it's within your facility? Who is doing the capacity building? Let's just be a little more practical.
The capacity building, it may be as the peer supporters, YAPs, doing the capacity building for our fellow adolescents at our facility. Then for health workers, maybe it may be the Ministry of Health, like for capacity building for health workers and service providers. And
Ministry of Health, we are already going external, but I want us to exhaust within your work environment, within your facility, before we call for Ministry of Health.
I think the staff at the facility who are trained, who are being trained, yes. Then prioritizing AYPs, like we need to be prioritized. Like we need youth days, youth day outs. Like we go through a lot, so we need like somewhat. How can I say it?
Okay. Are you saying these children who come at the facility just to be engaged meaningfully should be taken out, or it's
not really? Like let me say on a yearly basis, like maybe once in a year, like to make new friends.
Make them feel.
Who are making new friends? The children or
the adolescents?
The peer support groups.
Yes.
Peer support groups. Okay.
Peer support groups.
Okay. So you talked about health workers with poor attitude, but that means we have those that have a positive attitude and are doing it very well, engaging the children, young and the young people meaningfully. How can those who are doing it very well help others to do the same? From your perspective at your facility, what can be done in that area to support one another?
I think maybe to learn like from another person, let me say to sit with another health worker and then you talk about it, like you learn from others. How do they do it? How like even more meetings, attending more meetings, like how are we supposed to handle young adolescents, young people?
Okay. Okay, let's move on. What to the priorities and challenges that may require support outside your facility to create the change. And remember, the change we are talking about is to see meaningful engagement with the children, with the adolescents, with the young people. So when you mention the change, that's what we are looking at. So which are the external support might you need? If PATA is here and it wants to support in that area, what would you like them to do? And group members, you're part of this discussion. Do not let the representative die alone in their movie. You come and make an addition. You don't raise your hand, you walk.
Oh,
if you
just
have
come.
something.
Come
The
and
instructions
come.
are clear. Okay.
Member of Parliament. Here.
It's okay. Give the microphone. Give the microphone to us. Let's conclude. We are meaningful engagement. You want an addition to that?
Meaningful engagement.
How can can we support one another, especially those of us that have positive attitude already on engaging the children meaningfully and the younger people to see that everyone else at the facility does the same? Okay, I think you are meaning mentorship. Those that are doing it well can mentor others. Okay, let's go to the fourth. Are there things you're already doing in your facility or context in our country that the others can learn from to create a more supportive and empowering environment? Are there things that we are doing as a country or as your respective facilities that are seeing that the children are engaged meaningfully, the young people are engaged meaningfully, and the adolescents? What are the things that we're doing that others can learn from?
We at our facility, we normally do home visits. Like we go and we do dots. I think you know dots. Like we follow up. We follow you up. If you have missed appointment, we can bring you drugs at your home. Well, with adolescents with high viral load, we do dots whereby we follow you up, we call you, we do OVC screening, like, and another thing, we do engagements with your caretaker, whereby we do engagements with your caretaker, with adolescent caretakers. We give them support. We mentor them on how they should handle you, on how you should take your drugs. And we also do youth clinic days. Like we get a day, let me say in holidays, whereby we engage all young people and adolescents at the facility. We have some entertainment. We have some indoor games like we play ludos, we play chess, football, and I think, yes, that is it.
Okay. Great. Thank you very much, dear panelists. Right now, we are going to have you from the categories of the nurses, the doctors, the peer supporters, and then the other is. So we have a nurse that is making an addition to the contribution. So first over the microphone, you tell us your name and what you're contributing to.
Okay. I'm just very I'm assistant nursing officer with district. I'm working with the local government, and I'm a lab supervisor, and I'm a mentor. I move on different facilities to mentor on babies, on reproductive health services like family planning. Okay. I had some money issues, especially on the first discussion about working environments, and on this I'm talking on behalf of on the side of being a district mentor. I've moved to different facilities. I've met so many challenges with health workers, and some of these challenges is poor teamwork, and of which this teamwork has driven so many facilities to poor performance. And there are so many factors or other things that I think we have lead to this, and which I cannot read without talking about and look for the solution. One of the things that I acquired was that leads to poor teamwork workers towards delivery is unresolved or poorly managed interpersonal conflicts. The health workers have interpersonal conflicts which are poorly managed by managers. And once they are poorly managed by managers, this one causes divisions in health workers and places where working environment. Whereby you find even health workers fearing to eat or have something from the facility because they fear being poisoned, the other thing of so many things. And once the conflicts are poorly managed by managers, it creates poor teamwork. And another factor that I found out was irregular staff meetings. For staff meetings which are irregular create so many questions amongst the health workers because transparency itself will not be there. Data analysis will not be there because they will not be able to analyze their data and look for gaps and act accordingly. And finally, we need poor performance and even people will not, health workers will not own their own facility. When you don't own your own facility, you don't feel it that you are poor and you get a poor attitude towards service delivery. There is also another thing which
before another thing, what should the regular meetings look like? Those that are poor, those that are good and
okay. Ideally, as a facility, you need to sit in the documentary meeting first. Like if it is maternity or OPT or art, you need to sit in the documentary meeting before the general meeting. You consolidate all those challenges and other positive things that you've done, and then present them in the monthly meetings. And from those monthly meetings, you analyze your data, you look at different aspects of that leads to performance, then later come up with an action plan. And that action plan will be reviewed on another meeting. But you find that a facility takes like 3 months or 4 months without a staff meeting. And if it is to be there, you find that a certain manager will only get a certain proportion of health workers, discuss with them, then the rest of the health workers are on another angle. So you find the facility divided without moving at the same pace. And this affects performance. And also, what other driver or factor that they found out that leads to poor teamwork is low motivation, but rather from trainings by managers and mentors and supervisors. If when a mentor or supervisor comes to the facility or within the facility, will never recognize the positive part of your performance. Will look at the faults or the negative parts, and this one demotivates more the health workers. And also, it is my appeal that we as health workers providing these services, there is something which has been longing for. Like if you can also be given a life insurance benefit, because you see in the government, we don't have that, even at least with some non-government organizations. Whereby your child falls sick, yourself falls sick, and it is facility related factor, like for example, you get a pre-can't, you say no convert without, or maybe you have taken paper, you say no convert. But no one will look at that you got an injury from the facility. And for us, we are the ones, especially we midwives, we don't fall sick, we don't burden, we don't visit, so we are only at the facility working with all that pressure of work. At the same time, sometimes you work when you are under sickness. And the government has not come out to say maybe we have given life insurance to health workers to take care of our children. We'd also look at our lives being taken outside in case we have any problem. We also feel like you can also go to those good facilities when we are sick. We also feel like you can also go to those rehabilitative centers when we are having some mental problems or some stresses, and we are managed. So we don't have life insurance. It's my appeal to any organization that wish to help us or push it on, because we are really in a ship that it takes us somewhere, it pushes us at a certain corner. That is my contribution. you so much for listening. Thank you. Yes, she has brought out some issues, and that is what we need to hear. And if you're still sitting there and your issues have not been raised, please feel free. But right now, we have our own. Let me just mention, I think even some were meaning medical insurance. Because, yeah, yeah, just adding on, I think it's, she was meaning medical insurance. Yes. Because with life insurance, those are more of the insurance companies who you sort of have a package with them and then you sell something small with them. But I understand you. It's true that, yeah, that even under the Uganda Medical Association, something that the doctor wants to talk about. They're spending a lot of money to take care of them. Recently, there was a mobilization fund. These are waiting for a doctor who was very sick and they had to take the doctor to India. He didn't have any money, so you can imagine. But what she's really brought out, they are very touchy issues. Thank you.
That's a lot of soap.
Right now, let's see. This very well experienced. Members, let's put hands together and welcome Dr. Stephen.
Yes.
To this discussion.
In the studio.
I think I want to start here to get inspired. But really seriously listening to them, and especially her passionate appeal for support.
Yes.
Yeah, it's like sending you to the front line, and then and you know what to do, but you have no, you don't have the weapons needed to do the job. The best I can do, because I'm now retired, I don't sit and see patients. Okay, I talk to patients almost every day, but I don't have to wake up to go and prescribe. I can now, I don't even know how to prescribe. But when I was sitting there yesterday, I was requested to go and talk to managers of training facilities of under the Catholic Medical Bureau, which I'll be doing tomorrow, about patient-centered care. And then I put myself as a patient. And then this is true because around 99, I was a very sick patient. Of course, I had AIDS at that time. And of course, there was no treatment. Even the government was self-helpless. And, but I think the most, that's why I encouraged you when I came in to make sure you network, make new friends before you go back. The people whom I had studied with at Makerere in the early 80s, about 5 of them teamed up and bought from me ARV, depositing about $500 a month. Now, my salary at that time was less than $200, 300 maybe, as a doctor in Uganda. So there was no way I could have got that medicine. And then, looking at you, it is that to care for children, more or less you have to become like a child. Not to become childish, but to really put yourself in the position of the child. And actually it's the same to care for a person comprehensively. Means you have to try and put yourself in the position. What would you want done for you? Just like he has mentioned, all of us have something in mind. What would like, those of you read the Bible, it is in, I think in Matthew chapter 7 verse 12, that whatever you'd like others to do for you, do it for them. Forget about resources, that they are going to be enough. They are not. Even in the UK, which is a first world country, they have challenges. In the US, they have challenges. So here in Uganda, we have challenges. The good thing is we have people, very good people. And I find Uganda is very a unique group of people. For example, if you pass on a WhatsApp and you say somebody has lost somebody, you see for contributing. Have you seen it? Never mind, sometimes but they are so generous. So suppose we tap into this. I think this is what I would like to appeal to you. Make friends. And when you are doing this, look at it more as a calling than a job to make money. There is a lot of money in medicine, in service data, because all people will fall sick anyway, just like getting hungry. You can't go wrong if you are prepared food. And you cannot go wrong if you are a service provider. There's everything. We talked about HIV, but now there's mental health, which is a big problem. And somebody alluded to it, because you can get stressed. And many people are struggling with it. They can't sleep. Sometimes I wonder, this somebody posts on WhatsApp at 3:30. By 5:30 they are posting again. So when did they sleep? Could this be mental health problem? Because lack of sleep is a symptom of mental health. So yes, you better do some diagnosis on your child. But again, to say, we have the best, and the best is you yourself. So whatever you like others to do for you, do for them. I know even she mentions what she hasn't mentioned the worst things she has gone through as a health worker, and especially as your supervisor. The higher you go, the more stress you get, and so on and so forth. But me, I'm happy sitting here and really learning from you. I'm very excited that you are going to deliver these services, because we are depending on you. And this was depending on you. When it comes to HIV, of course, it's tough. So we need to applaud people like Ruta does not fear. Has come out with all his height to try and demystify this disease. But it's the same, whatever the disease. In fact, we are now removing a lot of stigma from HIV by having people like him and others who are able to demystify this disease, mainly because there wasn't enough information. So I think the best we can do, let's have the knowledge, and whatever we have, let's use it to do our best. With that in mind, suppose I was in this position, what would I do? What would I want done for me? And that way, we shall be able to serve our people. Thank you.
Yeah, thank you, Dr. Stephen. Thank you, our dear panelists. Ladies and gentlemen, let's put our hands together and appreciate the panelists. And in a special way, let's also appreciate Rosemary for passionately speaking. And of course, Dr. Stephen, retired, for adding to the discussion. And Dr. Margaret, our own, not forgetting her. Thank you very much, Dr. We've come to the end of our fishbowl discussion, and right now we just really thank you for being brave and stepping up to contribute. I know it's not easy, it's not obvious. The suggestions that you put across, the innovations and all the ideas are going to really help us to see that we continue advocacy to improve the welfare of the frontline health worker, but not forgetting our own, the peer supporters, and generally improving the work environment. Why we are here is to see that there is better service delivery to the children, to the adolescents, and to our young people. And you and me are the only ones that can bring about the positive change that we are looking for. So thank you very much for participating. Thank you for making this contribution fruitful. And let's pin up and have photos captured. Above it, we want to see Kampala satellite, because if we just share, they want to know where the photos came from. So
group members hope, let's spin up our work so that it is captured.